my colleagues in East Africa, South Africa, and from wherever you're joining. I want to welcome us all to this webinar. We're going to start. As young people, we don't believe in what people say, black man time. There's no black man time, so we must be disciplined, and we must start with being disciplined with ourselves with time. So for that reason, we are going to start, and please permit us. We've already started recording. With your permission, we want to continue to record because we want to keep the recording and continue to disseminate this information. I am your host for today's webinar, and of course, we know today is World Sexual Health Day, the 4th of September, and this day is quite important to us and the work that we do. I have amazing speakers who are set to take us through. I just want us to remind ourselves that the World Sexual Health Day reminds us that sexual health is fundamental to our overall, well-being. It's a day for us to reflect on sexual justice, promoting healthy relationships, breaking those stigmas, and ensuring that we have informed choices when it comes to advancing access to sexual and reproductive health services for all, regardless of the age, gender, and the background. We'll continue to advocate for a world wherein everyone can enjoy their sexual rights in dignity, safety, and equality. Pardon, maybe you may be hearing some windy. I'm currently in the southern parts of Sierra Leone where it's quite rainy, but nonetheless, we are going to forge ahead. I want us to be reminded that this webinar is brought to us by the Patriotic Empowerment Network Sierra Leone, P.E.N-SiL, that works here in Sierra Leone in terms of creating positive impact with the organization. I'm not the right person to talk about the organization, but I believe what they do is about empowerment, sexual reproductive health and rights, and create space for young people to lead and thrive. Please permit me. My name is Rosalind Judy, and I am your host. I am the National President for the Youth Action Movement Sierra Leone, which is the youth wing of Planned Parenthood Association of Sierra Leone, a member association of IPPF. And I'll be having 3 amazing speakers for this session who are my friends, colleagues, and they've been doing great across the world. I want to kindly introduce my speakers because they have their bios is so amazing. If I want to introduce them, I don't think today will be enough. But for the purpose of this webinar, one of my speakers is Magdalene Barach. Please permit me if I may pronounce your name poorly. Magdalene Barach is a Kenyan registered community health nurse with extensive experience in hospitals and community health programs across Kenya. Her professional journey has equipped her with both clinical expertise and strong commitments to advancing public health. Alongside her nursing career, Magdalene is passionate about youth leadership and advocacy. She serves as a public image director at the Rotary Club of Hurlingham and as a youth committee member at the Reproductive Health Network of Kenya. She also co-founded the Springs of Hope Global, a student-led initiative that promotes primary health care and community well-being. Her dedication has earned her recognition such as Albert Einstein Gold Academic Award and selection as Youth Advocate for Sexual and Reproductive Health Rights. She has also represented young people at major regional and international platforms, including the Africa Health Agenda International Conference and the Africa Forum for Displacement for UNHCR. Magdalene continues to leverage her skills in nursing, advocacy, and leadership to improve health systems foster equality, and inspire young people to become change makers in community. Ladies and gentlemen, Magdalene Barach. Please say hi to our audience, Magdalene.
Hello. Thank you so much for that immense introduction, and I am glad to be here. Thank you, Rosalind, and welcome the audience for the to this particular conversation. Thank you.
Thank you so much. That's Magdalene. For Magdalene, I'll go to Pemi. Pemilo is a first-year international relations student at University of South Africa. She is a passionate youth empowerment advocate and sexual reproductive health and rights activist, committed to advancing the rights and well-being of young people, especially those in marginalized communities. As an emerging youth leader, Pemi has strengthened her leadership journey by earning a certificate in civic leadership from the Yale Regional Leadership Center, Southern Africa. She has been recognized as a young feminist and awarded the Claire Matonish Scholarship, which gave her the platform to represent South African youth voices on SRHR through the Reproductive Health Network Kenya. Her passion for amplifying youth rights has led her to engage with various influential platforms, including the Education Plus initiative by UNAIDS, Soul City Institute, IPA Southern Africa, ActionAid's Young Urban Women Movement, MB Teen Lifestyle, and United Nations Girls Education Initiative, the UGEL. In 2024, she has served as the Y20 Technical Task Force team under the theme Inclusive Social Development and Fighting Inequality, Leaving No One Behind. Beyond advocacy on global platforms, Pemilo remains grounded in her community. She facilitates a kids' book club for adolescent girls, creating safe spaces to encourage dialogue, amplifying their voices, and promote access to quality education as a tool for empowerment and transformation. Ladies and gentlemen, please, by way of reacting to using your reactions, let's kindly welcome Pemi. I hope I get the name correct. Pemi, please unmute yourself and say hi.
Hi, everybody. Thank you so much. I'm so happy to be here.
So away from South Africa, we come to West Africa. I mean, my home. Our next speaker is Buya Nabi Bangura, a registered pharmacist, young career researcher, and demonstrator at the College of Medicine and Allied Health Sciences, University of Sierra Leone. With a strong passion for family planning, sexual and reproductive health and rights, HIV and AIDS, youth mental health and development, he stands out as a dynamic youth leader, compelling public speaker, and official event host. Buya is also a member of the Pharmaceutical Society of Sierra Leone and the Young Pharmacist Group Sierra Leone, known for his dedication to addressing social problems and supporting vulnerable communities. Currently, he is advancing his master's studies in public health. Buya serves in several key volunteer roles, including Family Planning 2030 Youth Focal Points for Sierra Leone under the Northwest and Central Africa Hub, and Trailblazer of the African Pleasure Hub for Sierra Leone, courtesy of SRHR Alliance Kenya. He is also the immediate former national and Western region president of the Youth Action Movement Sierra Leone, the youth component of the Planned Parenthood Association of Sierra Leone, a member association of International Planned Parenthood Federation, IPPF. Professionally, Buya has held significant positions, including pharmacist in charge at Healthwell Pharmacy and sales lead for social marketing channel at Maristopes International Sierra Leone. He is the founder and CEO of Patriotic Empowerment Network Sierra Leone, P.E.N-SiL, and has played a pivotal role in several national and subnational initiatives aimed at empowering adolescents and young people, especially those underrepresented and underserved. His leadership extends to board level influence, and having served as a board member of P.E.N-SiL, he currently serves as a board director at the Patriotic Advocacy Network. Buya continues to advocate, and he has had invitations to prestigious platforms such as the National Adolescent and Youth Family Planning Conference, the RHNK Pan-African Adolescent and Youth SRHR Conference that was held in Kenya, the IPPF Youth Forum and General Assembly in Colombia, the FP 2030 Landing Circles in Ghana, and the Next Summit. Among others, with optimism, humility, and strong belief in solidarity. Buya continues to inspire change and advocates for a world where everyone individual can live with dignity and drive their own destiny. Ladies and gentlemen, my speakers are fully loaded. Please, by way of reaction, kindly welcome Fam Buya. Please unmute yourself and say hi to our amazing audience in this call.
Karibu sana. Good evening, everyone. Thank you. I'm so happy. Thank you.
Thank you so much. As we've heard the amazing voices of our speaker, please, for those of us who are just joining us, we are recording, and today is World Sexual Health Day, and we are bringing you this webinar courtesy of the Patriotic Empowerment Network, Sierra Leone P.E.N-SiL. Today, the topic for this discussion is the role of sexual health in shaping the future of young people. And we're not going to waste any much time. We've had the amazing bios of our speakers. So I want us to start by way of answering this question. I want to start with you, Pemi. To what extent do you think young people today are aware about their sexual health and rights? And where are the biggest gaps in the knowledge?
Thank you so much to our wonderful moderator for asking the question. I think we have an increased number, of more young people getting informed about the types and where to access SRHR commodities. And, I'm saying this looking at two influential factors. That includes digital advocacy. I am a digital advocate. I create SRHR-based content that I share on my social media platforms. And majority of my viewership is young people. So that is one of the reasons why I'm saying I do feel like we have an increase in the number of young people that are getting informed on SRHR. And also looking at things like the SRHR-related WhatsApp helplines. In Kenya, I know they have the Nina na Binti. I'm so sorry if I mispronounced that. And in South Africa, we also have a helpline called Amy. That's for SRHR-related inquiries. And the gaps that I do notice with regards to knowledge has to be stigma and misinformation. And in the South African context, I do feel like in terms of engaging the youth, we kind of have lost balance with getting to the young people in the rural areas. So more engagement on SRHR, I feel in so many ways is more influential on the urban side of things than the rural side of things. So yes.
Thank you so much, Pemi. And from what you said, some of the gaps are stigma, misinformation, and of course, we see now we have increased number, and coming from a digital advocate, a content creator, you see the numbers, you see the statistics. I want to come to you, Magdalene. You're from the East Africa. I want to throw the same question to you. To hear what's maybe some of the gaps from your own region with regards to, when we talk about to what extent do we think that young people today are aware about their sexual health and their rights, and what's the biggest gap knowledge from your own perspective in your own region?
Thank you so much, Judy. Thank you for that particular question. I'm just going to delve directly into that particular question and answer that. According to how Femi has answered it, one thing we notice is the kind of challenges that we actually face as young people right now are more or less common. And when we talk about inaccessibility to a lot of sexual and reproductive health and rights services, that is one thing that is cutting across all areas in Africa, especially. I mean, it doesn't count on East Africa, West Africa, or wherever it is. It cuts around all the places. The other thing is, I mean, young people are more aware, especially after a lot of campaigns. And when you talk about HIV and AIDS, especially, it was more stigmatized and less awareness was created during the 2000 years and all that. But as young people right now, there is more awareness in regards to those lines. And we have less stigma because more people have more understanding as young people, and we can be able to support each other through the journey. Because most of the time, sometimes really, not because one wanted to acquire HIV and AIDS, but they got it anyway. So there is a lot of support from young people. And also one of the biggest gaps that I'm looking at this particular point is the fact that there is no access to contraceptive use, especially in rural areas. Like in Kenya, for instance, 73% of Kenyans only who are aged between 15 to 19 are the only ones, they do not really have access to contraceptives. One, because of a lot of stigma around it. The other one is because of culture. The other one is because of a lot of misinformation around it. You'd find a very young person in Kenya talking about cancer, about contraceptive methods causing cancer. Yeah, I mean, that is misinformation, because the whole point of having contraceptives is not because of the disease they cause or the side effects that come with it, because from a medical perspective, any drug would actually come with a side effect, yeah? Which then, the kind of misinformation that has gone out there because of contraceptives is extremely detrimental in regards to access to contraceptives and SRHR services. Because now, Africans being Africans and rooted in African culture would always regard access to SRHR services as immoral. Some of them actually find it as a taboo to talk about that kind of conversations. So it limits a lot of things in regards to those lines. Then there is lack of enough comprehensive education, especially under the young children, school-going children, yeah? You know, usually you have to start teaching these children when they are young. As they grow up, they know exactly what they're supposed to do. They know what exactly they're supposed to believe, because the moment you do not teach them from when they are young, they're likely to get up and actually get poisoned with the aspect that contraceptives cause this effect, contraceptives have these issues, and then they're likely to follow the same path. But at the end of the day, what we want to do is have change. So that means we need to have a lot of comprehensive education, especially for those particular kids in school. And then, I mean, the networks such as the Network of Adolescents and Youth in Africa, which work in Kenya, who have really brought these talks forward to young people, taking it to adolescents, and it's really becoming very easier, but still misconceptions and stigma and myths of infertility, especially in South Sudan and Uganda, still remain the same all over. So we still have a long way to go, but I can say strides have been made to this particular point. Yeah, thank you.
Thank you so much, Magdalene. I mean, a lot has been said and given us, coming from a medical, perspective. One thing that I captured is that obviously any drug comes with side effects, and those myths and misconceptions, we've been carrying it and looking at those hard to reach communities as well, the access to contraceptives and all of it. I want to encourage listeners in this call. You can as well share your own perspective in terms of to what extent via the chat, and we can so follow up too. And if you have questions as well, you can please put them on the chat. Let me come to you, Buya. We've had obviously all of the challenges, they are common, ranging from East, West, South, and North Africa. So I want to talk about, from your perspective and experience, how would you describe the current state of sexual and reproductive health and rights, and how are young people engaging with it or reacting to these issues from your own perspective, Buya?
Yes. Hi, everyone. Thank you for having me. And my colleagues have already said everything, like you said. Maybe mine is just to emphasize that we really have the awareness now as people, not just young people, as senior citizens, and including every other person. Even most times the opposition, they know that all of us are making progress. And that's why most times they have the extra energy to go against what we do. But again, we're also making progress because we now have more young people. We are here today because a set of all of us as young people agreed to be here. It is very late in Kenya. It is equally late in South Africa. Yes, from our end, probably it could be just late in the evening, not approaching now to the night hours. Because of these gains, you hear me, to be honest with you, this is why our positions are always on their gears. But we're making this progress. We now know what to do. We now know that even in the middle of financial constraints, we could leverage on connectivity. And that is to boost experience sharing. That is to understand what works better in other parts of Africa and what could be adopted in maybe challenging areas. And obviously, we also know now that even with limited resources, we're mobilizing our communities. We're engaging them to understand that we just have to be who we are, approach the realities on ground, and understand that we have a crisis of teenage pregnancy, we have a crisis of unwanted traditional practices, we have a crisis of sexually transmitted infections, and so many others. So if we say we act as if nothing is in the case, I mean, we act as if nothing is a problem, then we're just doing double standards. All of these things now we know. But in all of that, we still get restricted policies. We still have challenges to access youth-friendly services, adolescent-friendly services. Are we making progress in those areas? In some extent, yes, but we still have a whole lot to do. So for me, just to end, I believe with staying together, with getting these constant conversations, we would make the needed gains and we'll make those approaches, we will continue to make those approaches together and then move with that big movement. Thank you.
Thank you so much. I mean, Buya, you're in the western part of Sierra Leone. That's why I see you were able to join with your video. So, but I want to encourage us that maybe by the end of the call, we'll switch off our video so we'll have photo. But don't forget to kindly drop in your questions or your opinions as to what we're discussing. And please note that today is World Sexual Health Day, and we're talking about the role of sexual health in shaping the future of young people. And we've stated some of the gaps which are common and in terms of knowledge and to what extent do we think that young people are aware about the sexual health and rights. I want to come to you, Pemi. I want to know, how does society perceive and respect, in your own view, how does society perceive and respect the voices and opinions of young people when it comes to sexual health and rights? Please share with us.
Yes, thank you so much. I think when it comes to society's perceptions, we're more on like a neutral point of view. And that's because sometimes their perceptions are empowering and sometimes they can be dismissive too. And that's because of a lot of factors, surrounding sexual health itself and sexual reproductive health and rights. You have factors like cultural norms, you have factors like generational differences, you have factors like power dynamics that often create a pushback, so yes.
Thank you so much. So social norms, and speaking of social norms, I want to come to you, Magdalene. Please, you want to take us through what are some of these social norms or cultural barriers you think affecting, when it comes to sexual reproductive health and rights for young people, from your own view? What do you think?
Thank you again, Judy, for that particular question. So this kind of social norms that affect the access to sexual and reproductive health include like the cultural barriers. Yeah, Africans have always rooted their cultural values into a whole different point. Yeah, so when you look at we start having conversations about sexual and reproductive health and rights, then that's a whole space that we need to penetrate, and we need to penetrate into these particular communities and tell them that we're not here to actually erode your culture, but we're here to have conversations that are affecting us on real time, especially as young people. Yeah, because I understand that back then the communities never used to have these conversations with their elder generation. it's because of the kind of way we were raised up, but generations keep changing over and over again. Child marriages are common, especially in South Sudan. We're still struggling with child marriages. And according to the research done by UNFPA, actually more than 18% of young people are married below the age of 18 years. Yeah. So that means we still have a lot of culture rooted into the acquiry of sexual and reproductive health and rights services. That means there is a lot we still need to do. Again, another barrier is religion. Like in Uganda, the religious community actually worked against comprehensive sexuality education to be taught in schools. So that means we still have a long way as African countries, as East African countries, towards making policies available for this particular sexual and reproductive health inquiry. Whether we like it or not, these are things that are affecting us, yeah? And all thanks to organizations such as the Reproductive Health Network Kenya, which I am part of youth advocates in. I mean, we've been able to spread conversations to these particular communities, telling them that we are not here to erode your culture, but we are here to complement them, yeah? And speaking of real-time issues that are actually affecting young people in these particular communities, but we still have a lot to still to do with this within these particular communities, especially in communities, African communities, where youth voices are really hard at this particular time, but are they really hard to a point where action is taken? So that means we need to get to a point where, as African countries, we actually listen to these particular youths, and through evidence, of course, and through conversations with these particular young people, we need to understand that this is what they want as young people. To me, if someone tells me, if I ask a young person today, what do you want in regards to sexual and reproductive health and rights? And they tell me, I want what I want. To me, it looks like a very valid answer, yeah? Because them wanting what they want is a whole catalog of things that come with sexual and reproductive health and rights. It could be that they're missing sanitary pads, yeah? That is because of their context, yeah? It could be that they're missing contraceptive materials, commodities. That is because of their context. It's because we need to acknowledge youths come from different backgrounds, we come from different places, and we need to understand those particular issues at the core. Otherwise, we'll still be having the same barriers that we're having now in the next 10 years. Thank you.
Thank you so much. Acknowledging that we come from different, parts, different perspectives, and we crave for different things. So we must acknowledge those things, and then in terms of providing those services for young people, we must acknowledge that we're not the same. Today I may like it, long. Tomorrow I may like it short. So it depends on what we want and how we want it to be provided to us as young people. Thank you so much, Magdalene, for taking us to the social norms. And of course, religion we see, has been one of our major barrier. And even here in Sierra Leone, when it comes to policy, we see, our safe model bill that should enhance, the provision of, family planning services to young people is quite, put on hold because of that religion at it. So I want to come to you, Buya. How do you think we can going through or make gains or wins with regards to the cultural norms we are facing as young people?
It has to start with, first of all, understanding how far is this problem, especially to the places that we work at all times. And then we also need to do a bit more about movement building. We need to not work in silos. We need to not approach these people separately and with separate messages. I think that is one of the problems. We most times go to these places, we go to these communities with divided attentions. And in our case in Sierra Leone, that is why we're trying to really work in having the adolescent and youth mechanism, because with that, it serves as an umbrella where we could mobilize ourselves. So in a situation where we want to approach, let's say, parliamentarians, you cited the Safe Motherhood Bill saga. When it was very hot, we met as a team, all thanks to Health Alert and the MCGL team then. We met as young people, we developed our message, and then we even went to as far as having a press conference where we made our position as young people. We did that with clarity. We had our voice so very high with what we want and where we stand as young people. And I think that is also the same. If we were targeting this community A, how can we go to that community A with a very sound and clear message? How can we go and approach them, first of all, and then understand that they are also a part of the solution? We're not there to police them. We will not be there to criminalize them. But how can we also make them what they call community rural approach? Involve them from the very beginning to understand if we're talking about teenage pregnancy today, how can we have these teenage pregnancy messages, bylaws instituted so that they'll be the ones for sustainability driving that cause? I think that is what we need. And also we must ensure as best as possible we decentralize our actions. We must not only be working in just the urban areas and leave all other young people and other young movements happening in the north central areas. And I think that is one thing that I want to emphasize, that most times when we have our interventions, we only just settle at the central, the regional areas or the headquarter towns or the cities, and not go down there where I'm sure this information and intervention are really, really needed. So for me, that's that. Movement building, moving solidarity. And also, why is that important is because we now have difficulties to resource mobilize. So imagine if we have a team of 50 youth-led organizations driving a certain campaign. At least the little resources that we will have will make the correct use of them. Thank you.
Thank you so much, Buya. Taking it from where you stopped, movement building, I believe that's why we have calls like this and engaging ourselves virtually to see what is working well, in Kenya, what works best in South Africa, what works best in Sierra Leone, what works best, in other countries, and to see how we can leverage on those, what's working well, and how we can learn from what we're not doing right, and how we can try to see how we are going to align what we do to see that we meet the unmet needs of young people, and we ensure that we reach the hard to reach communities and we cater for all, not just those in the western area, or the big cities or the nice cities, but those as well in the hard to reach communities. So I believe that's key. And then you spoke about us not doing it alone, but working with people. We don't see them as competitors or those we're in competition with, but we see them as allies, and then we can enhance the change that we want to see, and to see that young people are educated for when it comes to sexual and reproductive health and rights. Thank you so much for that, Buya. I want to come to you, Pemi. You spoke about you being a digital advocate. I want you to please share with us what has worked best for you when it comes to disseminating, SRHR, sexual reproductive health and rights issues, and what has been, the high moment for you.
Sorry, Judy, please repeat the question. I didn't hear the last part. Thank you.
Yes, I was saying you could please share with us, you being a digital advocate, was what has worked best for you so we can learn from it, and, what has been your high gain, your high win?
Okay, yes, thank you so much for the question. So one thing that I do in my content creation is breaking down these concepts. I've realized in my advocacy through community engagement as well that sometimes young people feel disengaged because we speak to them and then we mention all of these concepts, using high vocabulary, and they feel disconnected because they're like, okay, what is this and what does it have to do with me? So what I do is I break down word for word. I've also realized even in the term sexual and reproductive health and rights, there's a definition for sexual, there's definition for reproductive, so even when we speak on policies, these policies are written in a languaging of high vocab, you know? So I always say, wherever I go, I just break it down. That's what I can say. And it works, because then I have young people in my comments saying, oh, thank you so much. I didn't think I'd feel relatable to that, you know? So yes, I think my highway would be, or my achievement would be seeing that young people are actually understanding these concepts and feel relatable to them as well.
Thank you so much breaking down the concept. And yes, we see when we go to those, me, I love relating it to those hard to reach communities, because those are the ones that, don't have access to, connectivity, internet, gathering those informations. How can we ensure that the messages or the information gets to them? And one key way is breaking down the concept, not just for them, but for even ourselves. Because when you go to communities and start talking about sexual reproductive health and rights, it's a whole concept. So we need to be breaking down our concept, and then we'll enhance more reach, and then we'll see more people are abreast with the issues, and then be able to take on those spaces that we want to take. I want to come to you, Magdalene. Pemi has shared, what works best, but I want you to take us through the practical steps or solution that you believe can improve young people's access to accurate information, safe spaces, and supportive policies on SRHR.
Thank you again, Judy, for that question. Again, I'll talk about destigmatization. As much as we talk about a lot of advancement in the sexual and reproductive health and right field, we still have a lot to go, and we still have a long way to go. We need to stop stigmatizing these particular services. Again, I'm heavy on healthcare and heavy on culture at the same time, because for you to deliver primary healthcare within these particular communities that are very rooted in their culture, you need to understand their language, you need to go down to what they believe in, and you need to also let them know that, you know what, we're just here to support you because these are the issues that are affecting us on real time. You might have not noticed, but really, these are the issues that are affecting us on real time. Again, doing a needs assessment within those particular communities. And look at a community like the Maasai communities in Kenya and Tanzania, yeah? They do FGM as a rite of passage. So one of the things that I would actually encourage to improve access to this particular information and to create safe spaces is, one, can we create alternative rites of passages within these particular communities? I appreciate what AMREF is doing within these particular communities, creating a different rite of passage within those particular communities and telling them that, you know what, this is your culture, we love it and we want to conserve it. But really, can we have this which is less harmful to support this particular culture, right? So that is one of the way to go. The other way is to do, I love what an organization in Uganda called Reach a Hand did. They called it edutainment, yeah? Whatever edutainment is they use entertainment to reach young people with sexual and reproductive health and right messages. Now, if you bring dancing, you bring other things like, let's say like, there are communities that actually practice male circumcision, and then they do ceremonies to that. You bring entertainment to the conversations that they actually bring in through plays, through comics and all that. So young people get to understand and put themselves there. Like the other day, we through the Reproductive Health Network of Kenya, we were able to go to an event that was really organized by a comic let me say a comic company called Shujaz, who have really been doing conversations on sexual and reproductive health and rights on real time. They use cartoons, they use comics to have real time conversations. And then you find a young person putting themselves into that position and they get to understand this situation more and more. These are things that we actually understand as young people, yeah? They're not things that are complex, but how they are presented, like Femi said, they are very, very complex. And people have to ask themselves, what does it have to do with me? So we have to break it down, like Femi said, break it down to their language, break it down to the language of that person in the rural area, because when we talk about leaving no youth behind, then we should be talking about those people who do not have digital access, talking about those people who do not really have access to hospitals that have youth-friendly services, And how do we then engage them? And how do we then put them into these particular conversations and ensure that these particular people actually gain the same services as the same person who is in the urban areas? The last thing that I'm going to talk about is mobile SRHR services, especially in rural areas. Why don't we take these particular conversations into rural areas? I love what NGOs are doing out here and taking those conversations into the rural area. Again, partnerships, private-public partnerships would really come in handy, because NGOs have really been doing this for a very long time. And we can, it's time to start having conversations with government and telling government, you know what, this is what we need as a health systems. We need this to strengthen the health systems. Yeah. Can we take these particular conversations into the communities? Can we ensure that when you're talking about primary health care, again, I'm going to be biased on healthcare because I'm a healthcare professional. When you're talking about primary healthcare, do these people understand why we're having conversations about HIV? We're having conversations about menstrual hygiene, about STIs. Do these people understand? We need to have partnerships with government so that the kind of policies that are set by government ensure that these particular people are put in mind, and they actually understand what is being done to them, instead of just going blindly and thinking that we have access to just giving information randomly. Like Buya said, one of the things that is actually killing us as Africans is giving this segmented information. I mean, if you give segmented information, a youth in the urban center has this, a youth in the rural area has this, a youth in an informal settlement has this, then we then get to have ourselves trapped into a point where youth do not really believe us. So it's time for us to put in effort in having synchronized information, that this is what we're looking at. And by having synchronized information, then we'll need to have policies. And these policies actually spoken down with the same language, from an urban setting to an informal settlement, to all the way to peri-urban areas. Yeah, thank you.
Thank you so much, Magdalene, for that wonderful contribution. I mean, you spoke about alternative passages, edutainment, and of course, you know, as young people, when we go with messages and then we tend to sing, we use the grammar, we capture the attention, especially when we go to those community settings, we capture the attentions of those our peers that we want to get. And then private partnership. Do they really understand why we're advocating for what we're advocating for? All of these come to play. I want to come back to you, Pemi. I want to throw the same question that I asked. What practical steps or solution do you believe can improve young people's access to accurate information, safe spaces, and supportive policies on SRHR?
Thank you so much, Judy. I will definitely back up what Barak said, because it's very important when she emphasized on the languaging, you know, in terms of making sure that the policies that are there are consolidated in different languages, and ensuring that they also speak to the realities of the people that they are addressing, right? So backing that up, I would say, we just need intentional implementation mechanisms, you know, and other solutions, improved service delivery. In the South African context, I have a lot of young people texting me, asking me, hey, where can I access this? Because I went to my local public healthcare facility and they told me they are out of this, you know. So sometimes that puts me in a little bit of a corner, because, oh my goodness, where do I refer you to? Because you're most likely to experience the same issue at another healthcare facility nearer to you, right? So I will stand firm on saying improved service delivery, because really our advocacy would be a myth if we spoke about access to SRHR services, but didn't have, you know, the actual places to refer young people to where we know confidently that they will be able to access these things. So yes, that is what I will say. Thank you.
Thank you so much. Yes, I mean, the same can be said when during our when we usually get our national conference on family planning. When we have colleagues from the hard to reach communities coming to the city, one of the key things that they say to us is that, you know, in our communities, we go, you advocate for these services, we get the information, and then when we go to these healthcare services, you know, they have stockouts. We don't have the contraceptives that we want. We may not meet the people who are supposed to attend to us. So intentionality, and then we improve on the service delivery. I think that's quite important. So, Buya, you want to throw light shortly from your own perspective in 1 minute?
Yeah, well, mine for me is just to emphasize the need for consistency, especially from the point of all of us being youth advocates. When we have our consistencies, we'll be seen as not being troublemakers, but indeed active and valuable partners. This is very important because most times when we sit in these rooms, in these policy discussion rooms or high-level meetings, no sooner you enter, if you're already perceived that way, nobody's taking you anyway serious. And I think that is one way to also drive this sustainability that we need in terms of our service delivery, in terms of whatever it is we discuss within the landscape of family planning and sexual reproductive health. Importantly, also, I think we have to be very vigilant with resilience to ensure that when we have these recognitions, we try to be also available at all times. I know it could be very painful, but if you really know that this cause is not only for you to get, oh, let's say I want to attend this meeting, or I want to attend the other meeting, but you're doing it with purpose, the reward would come. And that reward of you seeing a reduction, a drastic reduction of maternal mortality, a drastic reduction of young people dropping out from schools, I am very sure you will be very pleased. And even if you don't have the much more applause here in this world, as a very religious person and faithful person, I believe God Almighty will take us that way. But let me end with this, that colleagues already spoke about how do we need to preciously have favorable policies developed. But I'll look on the bit for intentional implementation and importantly also evaluating what is it that we are doing. Sometimes we could be implementing these policies, but not as much as we're supposed to have done that. So joint evaluation and monitoring to assess impact could also be very important. We don't want to just say we've delivered 500 million condoms to people. We should also know that after this delivery, were these condoms properly used? Because again, it is one thing to say we've given this, but it's also very importantly okay that we assess if what we gave was indeed used for the right purpose and the right way. The same is also true for all of our service delivery points, all of our services, including information. So in case, again, we talk about how do we follow up on the available policies, we should not only just down tools after the launch of these policies. Our next move should be, how can we get youth-friendly, adolescent-friendly versions of those policies so that we get to understand what is it that, for example, our Family Planning 2030 commitment for our commitment-making countries. How much as young people, as youth advocates, as adolescents, do we understand this document? How much? And if you don't know, there is no way you can hold duty bearers accountable. There is no way you can also be a part of holding that accountability starting from yourself. Thank you.
Thank you. I'm unmuted. Okay. Thank you so much, Buya, for that. And of course, we must be aware, because it's only when things you know that you can be able to hold people accountable for, especially our duty bearers. I want us to now look at, we've shared our perspective, the gaps, and then what, practical steps, solutions, the cultural barriers. For now, let's look at the role we think young people ourselves should do in shaping the future of sexual health in Africa. I'll start with you, Baraj. What role should young people ourselves play in shaping the future of sexual health in Africa?
Thank you so much, Judy, again for that question. So again, young people are the biggest pool that we have as Africans. And the moment we take very good care of them, then we're likely to have very positive results. But again, that could work against the African continent if we do not really take them seriously. We've recently seen from a couple of revolutions in the African continent by young people. Yeah, I mean, if these young people are actually out there demanding accountability, then that means they are working for the good of the country. But again, the same people, if not engaged and not given good information, they could be actually detrimental for the countries. Remember, 70% of the population in Africa is actually youths. And that is such a huge population not to joke with. And the role of these young people is actually significant in the future of SRHR in Africa. Especially, young people have really come out very clearly with good innovations. Like recently, I attended a conference called Afia Fest. This particular conference was bringing young people with different innovations together, especially in healthcare. And I was looking at the kind of innovations on sexual and reproductive health and rights, and I was immensely glad that young people are actually taking initiatives. They are seeing issues and they are taking initiatives. I personally call young people change makers within those particular communities, because there is no young person in this particular generation that will actually see a problem and not want to settle it. No matter how little they're going to do about that particular issues, they're always going to have to do something about it. So again, cultural transformation starting from the villages. Coming from an African context, my grandma will totally understand believe what I have to say, compared to having to understand that particular their age groups and all that, because they're likely to have the same conversations. Yeah. But again, they understand that I've gone to school. I am now aware of the current situation, and I am able to change the community. Yeah. Because the sole goal why African children are taken to school is to change their communities. So again, what information do we give to our communities? Yeah. And what do we tell them that about the issues on sexual and reproductive health? Right. Let's talk about maternal and child health care, which is an issue of SRHR. Yeah. When you talk about maternal and child health care, we've not gotten there as an African continent. We still have a lot to do, but now we need to transform our cultures by giving them the right information. Now, policy participation. Different governments come up with different policies, and they call for public participation. Do we as young people really go to those public participation forums? Do we go there and talk about that this is what we like as young people, and this policy is going to work for us, this policy is not going to work for us? Or do we just wait for these policies to be installed, and then now we start rioting about them? We're saying those policies are not for us, they're not really working for young people. Do we really participate in those particular forums? It is time for us as young people to get up and ensure that we participate in those forums. And also, young people, one thing I love about us is the fact that if you're not given a seat on the table, we're always creating our own table, which is a good thing. And creating our own table means telling the government, telling the private partners that this is what we want as young people, and this is what we're looking at, and this is all that we're actually looking at as young people, and we want this as young people. And having a voice as young people is what will really save the continent at this particular point. And again, as I said, we are the future of Africa, and we're the future of the entire continent. So again, positive social media use and digital advocacy. I applaud Femi because I look at her content every single time. I look at what she posts every single time, breaking down this information and really giving people a reason to believe that SRHR is here for the good of all of us and not really to work against all of us. I love the fact that you're using your digital advocacy very positively to impact people and young people. It is time for young people to actually start looking at that. How do we use our social media pages? How do you use our digital advocacy platforms to speak to people out here? And also, can we challenge these harmful practices that we have within our communities? There is a lady who used to be an ambassador of AMREF. She's called Nice Nalengete. She's from the Ma community. And all of us, if you have any idea of the East African culture, we have the Maasai community. Maasai community practice FGM a lot. But Nice was a member of that particular family, and she of that particular community, and she decided, you know what, I'm going to change my community, not to replace their culture, but to educate them that whatever harmful practices that you're having on these children are impacting their healthcare in this and this way. And in turn, it is affecting our community in this and this way, which is not good for the future of our community. Can we look at this kind of things that is going to improve our engagement in regards to our culture and removing all the harmful practices? So it's time for us to wake up and understand that we need to do away with those harmful practices and challenge the status quo. Who are you as a young person if you cannot challenge the status quo? It is time for us to stand up for our rights and challenge the status quo. Thank you.
Thank you so much. Stand up for your rights and challenge the status quo. That was a lot. We're rushing because we don't want to be cut off here with time. My colleagues here, they've been on this call and it's quite late from their part. So I want to ask Pemi, can you briefly share with us what is the role of young people in shaping sexual health and rights?
Thank you so much, Judy. Barak actually covered most of the stuff, but
Yeah.
I will say that strengthening collaboration amongst ourselves is important, sharing best practices and being each other's accountability partners. Let us choose to be a very different generation that won't be asked to be accountable for actions in the future. So in the things we say we would love to see, the change we say we would love to see, let us stay consistent on that. And let us also remember on why being united as Africans is very important, because I will say none of our freedom matters if any of us is not free. And what I mean is, if I reach certain goals in South Africa, I should not, just sit back and say, oh, my job is done. I should also look at other African countries and say, how can Kenya do the same? How can Sierra Leone reach the same target as the one I was able to reach? So yes, strengthening collaboration amongst ourselves. I was really happy when Buya reached out to me saying he would love to organize this webinar. And I said, this is exactly what I talk about when I say we want meaningful youth engagement. So yes, thank you so much for the opportunity once again. Yeah.
Thank you so much, Femi, and it's amazing. So we're strengthening collaboration. So those of you, please kindly follow Femi on all our social media handles, and then you see the amazing work that she's doing. Buya, please, in your own perspective, in 1 minute, what role should young people themselves play in shaping the future of sexual health in Africa? And maybe your last word.
Yes, mine would be, we need to really self-capacitate our very selves. We must not wait anyone to do that for us. And I'm sure if you really get the capacity, you have what it takes. If you have that opportunity, whether you created it for yourself, whether it was created for you, you will make the most out of it. And importantly, you realize that you're not only speaking for your individuality, but for all young people across the continent of Africa. And I used to tell myself, I'm not the Sierra Leonean, I am a global citizen, I am an African, and then importantly, you can call me now a Sierra Leonean. This is because I think global. I think Africa regionally, and I think Sierra Leone, and I think young people. I think all of us. That cannot be possible. It could truly not be quite well if you don't get the capacity to do so. Read more books, know what is happening across whatever it is that we do at national level. Do not just say because you are not affected, it's none of your business. It is your business. And I keep saying, nobody is safe until everyone becomes safe. Get attention, show interest, capacitate yourself. If any policy is in the cause of development, even if you are not in the room, as far as you know, try to find out, where are we? Do we have any challenge? If in any case the policy now is launched, try to read that policy, know the commitment that they've made, and importantly, try to reach out to those people that are supposed to be the implementers. How can I be a part of this? I've attended many programs that I found myself because I reached out. You must not only wait for people to invite you. Hence, you know this is within my context and within my theme. Show the interest, make the move. You are not a less person. You are just showing that you are indeed fit for purpose. And just lastly for me, what we could also do is to intensify our intergenerational collaboration and dialogue. For mentorship, we need true mentorship. And I just pray and hope that those mentors will not use us for reasons best known to them, but for the right purposes. But we need mentorship, we need coaching, so that what we do would be guided with facts, to be guided with resilience and passion. And just to end on my side, I want to really thank you very much. Like Fabi said, when I reach out to her, it's a yes almost immediately. The same for Barak, the same for every member of these speakers and coordinators. I'm so humble. And this is also to commit that my team and I at Patriotic Empowerment Network will keep reaching out. I've seen Lauren, I've seen many colleagues from West Africa, from East Africa, from South Africa, of course, and also from all of us in other parts of Africa. This is impressive. And these are all rules that we are showing that indeed we care. Indeed, we care as young people. We're meeting very shortly again. If we don't have any other session in between now and the 20th, we're targeting to have the World Contraception Day, another very grand webinar, hopefully. Or maybe we'll find a way, if we can, to get an in-between webinar before the World Contraception Day. I want to thank you very much indeed.
Thank you so much, CEO and founder of the Patriotic Empowerment Network, Sierra Leone, who doubles as the FP 2030 Youth Focal Point for Sierra Leone. And I want to use this opportunity to thank our incredible speakers who have shared their passion, their perspectives for today, from Barach to Pemi to Buya. I want to thank myself for holding it down for us today. And I want to thank our lovely audience. Your presence and engagement have made this conversation even more meaningful. Let's continue to keep up the dialogue and continue to spread the messages and continue to create those online spaces and collaborate with ourselves. And I want to say, as we mark World Sexual Health Day today, we must all commit to create a world wherein we can have access and justice in sexual health, and truly, so we can see that everyone is not left, everyone is taken along, no one is left behind. Thank you all so much. Until next time, I have been your moderator. Can we turn on if you feel comfortable,
Yes,
can you please turn on your video so we have
see these speakers though.
these speakers now.
Why were you
so
hiding? Why were you hiding? What's going on?
Let me. Amazing
Fuck
audience,
you.
please, can you turn on your
From
camera? Let's have.
Harare. 40 from Harare.
Where are
Show
you
your face.
Come on, please take photos.
You
We
show
don't
your
have
face.
electricity in Harare, bro.
I'm looking so beautiful today, eh? Guys, thank you so much.
Yeah.
You see,
Guys,
we don't
let's
have
just
electricity.
Thank you so
fuck
much,
you.
and
Electricity
to
has
our
nothing on
colleagues
you.
in the East, South Africa,
Yeah,
thank
you
you for
see.
creating time. I know it's quite late from your end. Thank you so much. We'll keep up connecting. Thank you.
Much, team, for joining. It has been an insightful session. Thank you.
Yes. Please,
Until next time.
can somebody please take a photo so we will use that hopefully?
We
But
are
still not showing.
you're taking photos.
Yeah, we have to at least keep record. Oh, I can see Vice President of P.E.N-SiL. Okay.
Yeah.
Usainatu, where are you? Show your face.
Beth.
Nisha, Murigi, Jessica.
Please, wait, am I looking very beautiful?
Why? What are you? You don't need to ask that now. You always look that.
Thank you so much, guys.
Thank you, guys. Thank you. Thank you, Mr.
Bye.
Dati.
Thank you so much, everybody, for joining.
Thank you, guys. Bye.
Thank you, team. Until
Have we
next
gotten-
time. Bye.
Have we gotten
Bye.
a picture, please?
Yeah.
You share with me. Thank you. Thank you,
Okay.
guys. See you soon.
As the host, I'll be the last to leave this call. So bye. Thank you.
Thank you so much, Meto, and thank you for joining us.
Yeah.
Thank you for all our audience.
Bye
We
once
couldn't
again.
thank you more, and thank you for your support.
Asante sana, Barak. Asante sana.
Thank you, Meto. Thank you,
Asante
Ned.
sana,
Thank you,
asante
Nika.
sana.
Thank you, Aurea. Thank you, Jessica. Thank you, everyone.
Thank you.
Thank you, Abbas. I see you, Abbas. Thank you.
And to my Rotary family, thank you for supporting me in coming here. And my RHNK family, of course.
Yeah,
Of course.
Reproductive Health Network Kenya. Thank you. Thank you.
RHNP.
Bye, guys. Good night.
Bye.
Hi, guys.